So most people would call it a crossed eye. The medical term is esotropia, and that literally means inturning of the eye. And this is where an eye, or both eyes, are turned in relative to each other and will look like they're turning in towards the nose. Usually you'll just see one eye turning at a time because the kid, or an adult, if that's what we're talking about, they'll keep one eye straight ahead to look with and the other eye will be crossed in. But they're usually crossed in relative to each other. So the opposite would be, people would often refer to a wandering eye, where an eye is turning out towards their ear, and that's called exotropia. Most of the time, true eye crossing is not going to fix itself. So the most common type of eye crossing happens when children reach somewhere between ages 2 and 4, and that's usually because they're very farsighted. Nobody knew it before that, but they have to work really hard to focus through their farsightedness, and that will cause their eyes to cross. And that we might be able to fix easily with glasses. Eye crossing otherwise could happen at any time during childhood. Sometimes it even happens for babies. If it's severe and the eyes are crossing in towards the nose, even out to 6 months old, we may have to do surgery for that early on. Other types of eye crossing during childhood might also require surgery, but we always try to go to glasses first if we can. For the kids that are very farsighted and we put them in glasses first, most of the time that will be successful at keeping their eyes lined up straight. So they will continue to cross their eyes when their glasses are off, but that's okay as long as their eyes are straight with their glasses on. That's what we're looking for. And a lot of those kids will outgrow their eye crossing when they get to the early teen years. For kids that need surgery, the success rate's pretty good. We can never promise one surgery and that's all they'll ever need for their lifetime. But I would estimate 70–80% of the time or more, one surgery we can get their eyes where we need them to be, and that's it. If you or your doctor or another family member, if anybody is concerned about crossed eyes, it's better to come in and get it checked out. We love it when we can see a child and be able to tell the family, you know what, their eyes are working great, they kept them straight the whole time we were examining them today, and we're really not that worried about their vision development. But we really want to catch things early. So we'd rather, if there's any doubt in somebody's mind, we'd rather them come in, let us do an eye exam, provide some reassurance, and if there is something to deal with, then we deal with it young. My name is Dr. Jeffrey Colburn. I am a pediatric ophthalmologist here at the Spokane Eye Clinic.